Good morning, and welcome. I know we haven't been live for a minute here, but welcome everyone to the Cherilyn Lee Health Show, and you're listening live today. And my wonderful guest is Dr. Arnold Takemoto, who is no stranger to the Cherilyn Lee Health Show. And because we're seeing so much of this happening, and I have a healthcare clinic, and it's just amazing what is happening in our world today when it comes to antibiotics and people who are coming up with all these infections. We're seeing so many of them. So we have good news for you. One, we're going to talk about resistant. Well, why it's such a major problem that people are being resistant to antibiotics today. But not only resistance, we do have information for you to help you to be a much better, healthier person. So thank you so much, Dr. Takemoto, for being a guest today. It is such an honor to have you here.
Oh, my pleasure, Dr. Lee. It's always a pleasure.
Thank you. So we're going to kind of jump right in because there's so much to cover today. And why are people, and I basically know too, but I'm going to let you explain why people are resistant and why. Number one, let's do a little history. You wanted to start off with infections themselves.
Certainly. A number of years ago, let's just say 30 or 40 years ago, the normal Western medicine was able to deal with these infections. People may have gotten what is called a nosocomial infection, which is an infection they get at the hospital. And it was dealt with antibiotics and other methods which got rid of the problem. Then it was discovered that they can increase yields, potentially increase the longevity of pigs, chickens, beef, pork, etc., by feeding antibiotics. So they even added it to the food if they didn't want to inject the animals. And that was very easy to do. They had increased yields, and everyone was happy. The problem with time is the pathogens that these farm animals got became more and more resistant, so they use stronger and stronger antibiotics.
Exactly.
Well, we eat those animals.
Now, some people do.
Now, yeah, not everybody.
No.
And now we have strains of what is called superbugs. And they're literally superbugs. I lost my accountant because of this. I pleaded with the family to take her out of the hospital. The different protocols I had taught doctors all over the world worked very well. And within 2 days after a simple female surgery in the hospital, she died from a systemic infection that was resistant to all possible approaches by the hospital. So this kind of hits home. I had known her before for over 20 years. And what has happened, that the public all of a sudden became aware, it's been there before, but no one really took anything. It was kind of pushed under the table, swept under the table, shall we say. But that football star in the Pacific Northwest got MRSA. MRSA is methicillin-resistant Staphylococcus aureus, and died because of this, and traditional approaches did not work. So now it became front page of the newspaper. It was on radio programs then. It's kind of been diminished by now.
It certainly has. You don't hear a lot about it like you used to.
No, it's still there.
Mm-hmm.
And now we're getting attention to other pathogens such as C. diff and necronizing fasciitis. It sounds like a big fancy name, but people call it flesh-eating bacteria.
Mm-hmm.
And if it's resistant to current approaches, they just cut, and more cut away the infection. And so what do you do? And it's people like you, unfortunately, if they're in the hospital, it's hard to do anything. But if you get a antibiotic-resistant infection, it's really important to perhaps first come to someone like you to get treated rather than avoid the hospital. And I just want to go over what has happened. Remember, we used to spray mosquitoes with DDT?
Yes.
And now they kind of laugh at DDT. So what has happened is they have evolved, and let's just say out of 10,000 mosquitoes, 9,900 died from the DDT. Those 100 or 1,000, whatever it is, may have some level of resistance, and through the generations, they become stronger and more resistant. That is what happened with the evolution of these superbugs. And they're kept quiet, pretty much in the news. And what do? I had, in the last 2 years, 4 cases of friends. These are friends. I don't have a clinic anymore. I've had 3 different clinics staffed by doctors, nurses, etc. But this is just friends, and they had antibiotic-resistant MRSA.
Oh, my.
And there was nothing they could do. It was just spreading. So even though they knew me, they finally broke down and called me, and I worked with them, and within a couple weeks to at most maybe 3 weeks, all 4 were in remission, still alive, doing great. And they avoided going to the hospital. The hospital wouldn't help because they had truly very, very strong antibiotic-resistant infections. And, of course, there's viruses, and antibiotics don't work very well for viruses. So what are you going to do? And there's been other friends. They developed infections in spinal cord and brain, and they never made it out of the hospital.
I know.
Despite,
you know, while you're saying that, I went to, excuse me, I had someone wanted me to go visit someone in the hospital. And because they didn't quite understand of what was going on there. And when I asked them, I said, which antibiotics? Because they said, well, there's an infection. I said, well, where? And they said, well, we've done these tests and this and that. I said, okay. Well, you have this person on every antibiotic there is. And just destroying the immune system. Antibacterial. They said, well, we're going to use every broad spectrum antibiotic in the hope that we will get rid of this infection.
That is correct. And what if it's viruses?
How do you have many antibiotics going in one person at one time? And the person is still very, very ill. And, it's just amazing what's happening. People talk about health care and everybody needs to have insurance. But my primary concern is quality care. And we have to learn how to take care of yourself first. It starts with you. There's a lot of things we can't control in our environment, but it really starts with us.
Well, it's really important, of course, to keep your immune system up.
Yes.
And the quality of food now is not what it used to be 30 or 40 years ago. And so, a lot of the micronutrients, vitamins, immune modulators, etc., present in food then is not in our food now. So it is difficult even to do that. You have to take supplements that are extremely high quality and are targeted to manage and modulate your immune system.
Right, because
And that is
not all products are created equal.
absolutely. So, and it's not, some people say, well, I haven't had a cold or flu in the last 5 years, so I have a good immune system. That's partially true. There's, of course, a lot of factors, but it's not just they have a great immune system. They may have a poor immune system to certain bacteria or viruses or cell wall deficient forms, which are very difficult to treat with traditional medicine, and that's called mycoplasms. So, I got a call from a doctor here just a few days ago, and he said he has a patient that has been in the hospital, that has been treated with herbologists and et cetera, naturopaths, and have had this infection for years now and still has it. And finally, she has decided to have this doctor treat her. And, of course, he called me, and there's some things he didn't have, and so I shipped them to him and also the correct supplements and designed a little program for his patient. And I'm sure she's supposed to come in today, and I'm sure she will do well.
Yes.
But I've seen this frequently, and what's so unusual, I have a dear friend, she and her husband, they're up in the mountains, and he was out working. Their house is surrounded by forests. He was working, and he got scratched by probably some sort of blackberry or raspberry or some bush. He developed an infection in his leg. It wouldn't heal. His internist, prescribed quite a strong antibiotic. That didn't work. It then also spread to under his arm, which is not uncommon for MRSA, and called me up, and I said, have your doctor culture, and it was antibiotic-resistant MRSA.
Oh, my.
All the lab tests showed antibiotics didn't work, and, of course, they put him on the strongest oral antibiotic. That did nothing. And I said, you have to come down here. He said, I can't. Every day we have students from ASU and from Gateway Community College that we're entertaining up here, as much as 80 students. So I sent some stuff up, and I couldn't believe it, but it worked orally. And he got rid of his MRSA. He didn't have to come down here. His doctor was going to put him in the hospital. And he just couldn't be in the hospital. So, this is so common, I can't believe it. And a lot of the mortality that's in a hospital, let's put it this way. If you're sick, unknown infection, you go to your doctor, what does he do? He prescribes antibiotics. If that doesn't work, he may either use a real strong antibiotic or send you to a infectious disease doctor, and he will prescribe the strongest known oral antibiotic. If that doesn't work, what do you do next? The doctor puts you in the hospital. So now you're going to the hospital with a very virulent antibiotic-resistant infection. Maybe not the best place for people to go.
Yes, we do know that.
And despite the cleanliness in a hospital, there's airborne. These bacterium are airborne. It could be touch, doorknobs, elevator knobs, wherever it is, could be transferred. So, we live in this world now that has these superbugs. And I wouldn't have expected this person way up in the mountains to get a superbug infection. And incidentally, it was cultured. It was MRSA. So you have to see a healthcare professional such as Dr. Lee who utilizes the right protocols to help you and to catch it early. I can't stress this enough. Incidentally, I hate to say this, I just read an article on water compared to Coke or Pepsi. And there's a 35% suppression of your immune system by just drinking a can of soda pop. Isn't that amazing?
That's amazing. That is amazing. And that's why I tell people leave it alone, because it's sugar. You don't want the sugar, and you don't want diet sodas because you don't want the aspartame, because we know the multitude of side effects of that. So why drink a soda? And then it has other chemicals in it that's going to cause you bone loss. So you just want to stay away from things like that.
Oh, I agree.
You know, there is a question from Loretta from Texas, and I want to thank you so much for your question. Her question is, does resistant means the infection can fight off the treatment, or does it mean that the infection can it also reoccur? The disease reoccur?
Well, of course, anything can recur. It may be tough to totally get rid of the infection, and this is especially true of lungs. People who are prone to pneumonia get recurrent pneumonia infections. And this is what I found, and I get emergency calls from all over the world on this subject. The important thing is, of course, to get rid of the infection. Hopefully the body has produced some sort of antibodies to the particular pathogen, and then it's less difficult to get it again, assuming you keep your immune system up.
Yes, and you know, it's also, we discussed this before, the EMFs, and we also discussed the smart meters. I mean, things that are also going on around you in your environment. Because a lot of times people think they have reoccurring pneumonia or reoccurring infections, and then think it's gone, and they need to continue what they were doing to get it to go away. I'm not talking about antibiotics, but if you were doing a treatment, if you had increased more vegetables and raw foods, whatever you did to help it to go away, continue that. Because a lot of times you think those bugs are gone, and they're not. The same thing with antibiotic we used to do years ago. We would put a place, say if you had strep, and it's a very vigilant organism if you have strep throat. If you take the antibiotics and you take it for a couple of days, you feel better, and you stop, that organism can settle in the heart, and it hits the mitral valve of the heart and cause problems, or it can settle in the kidney, this strep organism, and cause kidney problems later. So a lot of times people with kidney problems, they'll ask, well, I do, have you had a sore throat? Was it cultured? Do you know what organism it was? Because a lot of times those certain organisms can hit other organs, and they're not gone. They're lying dormant, they mutate, and they settle somewhere else. So you want to stay on a healthy program or lifestyle change all the time. So if you splurge a little bit and have, some, slice of cake, or go to a birthday party and have something, then, start doing something to cleanse your system up from that. It's really important. But a lot of times people start to feel better, so they stop getting enough sleep. They stop, they forget to drink enough water. A lot of things, they kind of go back into the habit that got them there in the first place. So they get reoccurring because actually the body was never well in the first place. You just felt a little better. While saying that, can I just say this? I saw, I don't watch a lot of TV, but one night it was just on. And everybody have kind of seen, and, not everybody, because a lot of people don't deal with antibiotics. People have called me and said they have taken something called a Z-Pack. that was familiar. Now it's in the news that, or they have a group of attorneys doing a class action lawsuit saying that this antibiotic caused chest pain and heart attacks
Yes.
and even death and even atrial fibrillation. So if you know someone who's been on a Z-Pack, go online and look for the attorneys because there is a class action lawsuit if you know of anybody who's been on it because I haven't even seen that commercial. But again, I rarely have the TV on, but just so happened had seen that because people think, it's fast acting. You only take it for 3 or 4 days and then they start to feel better. So some people don't want to miss work and they don't want to go through the wonderful natural regimen of trying to get well and want something that's going to be more spontaneous to heal. But if you know anybody on the Z-Pack, you can always go online and you can find the group of attorneys that have this law. Uh, and I would have never thought an antibiotic would have actually later on caused you to have a heart attack or atrial fibrillation. That's when the heart is beating too fast.
Yes, and it's Z-Pack or zithromycin used to work really effective. I remember when I had the cancer clinic, and my doctors would prescribe zithromycin or Z-Pack, and it worked great. I mean, people who had upper respiratory infections, they started getting relief within a couple of hours. Now, I frequently hear of friends, and they call me up because I guess I'm the last straw, that they use Z-Pack, and it helps a little. And it's a week later. They've gone on double Z-Packs. So, again, it's a frequent use of antibiotics, and it's the evolution of these superbugs that are occurring.
Right.
And
I'm
it's
sorry.
like threatening.
Right. And Loretta, you had such a great question here, and I'm hoping, resistance, you wanted to know what it meant, as far as infections, fighting off, or the treatment. I want to make sure that I make it clear, or we answer that question for you, because resistance we do what is called a culture and sensitivity test on, say, a throat culture, or if you have an infection somewhere in the body, and they send it to the lab. And the ones that's resistant, we know that we're not going to give it.
That's correct, and may respond to traditional approaches. When it doesn't, the protocol that I have used is quite simple. You need a very strong immune modulator, not immune booster, modulate, because let's face it, the first and last defense against a foreign intruder is your immune system, period. And so you don't want to suppress it. Obviously, you have to minimize or avoid sugar intake. You want to modulate it so it can kill the foreign intruder. And so what I use, in a nutshell, is a product called Immune Rich, and they're capsules, and you can obtain all of these from Dr. Lee's clinic. And it is an inexpensive approach. It's got 7 different immune-modulating mushrooms, lactoferrin, beta-glucans, etc., all in a great product at a very reasonable price.
Oh, yes.
Also, vitamin C for the viral component and help detoxification, and you need a non-corn derived. And there's 2 types. One's called ultra-absorbic C. That's the best one and the best absorption. The other is called Super C option, and it's far more economical, but of course doesn't have the absorption. And it's all from non-GMO corn source. You have to detox the body of heavy metals, such as mercury, lead, cadmium, arsenic, etc. And we all are loaded, or we all have heavy metals, especially if you live in Los Angeles area, Remember, they used to allow leaded gas. Well, it's illegal now, but there's still some arsenic and cadmium in diesel fuel, and the lead is settled into the soil. So when the wind blows or you breathe dust, you're still getting some lead or some other heavy metals. And of course, if you smoke, you're getting cadmium and arsenic. So we are exposed to the heavy metals, so you want to optimize and detox the body, at least at some level of those. And then lastly, I suggest restoring your flora with a good flora for your gastrointestinal system, i.e. stomach and intestine and colon, to help prevent the body from fighting other pathogens such as yeast and chlamydia, pneumoniae, and H. pylori, and stuff like that. So it is important for those fundamentals, and that's the approach I use. We do add a product called Nano Silver Complex. It's very unique. It is the only silver product. It's not a colloidal suspension. Doesn't produce what is called argyria, the permanent discoloration of your skin. And it's atoms, not clusters of molecule, which is typical colloidal silver. And it's the atoms are bound to oxygen.
So this would help with a person who would have very low oxygen levels in their blood.
It helps with that. It also helps, of course, with pathogens, and that's where I'm going. As I mentioned, another doctor just recently called me, very, very resistant mycobacterium infection, obviously resistant to all the antibiotic treatments. And so his patient is very sick. So I sent over the proper things for that. And she's going to get treated starting from today.
You know, because I actually had, it was a vegetarian wrap, but it was something, I'm sure it might have been salmonella or something, but it didn't hit me until late that night. It was kind of evening. And I'm telling you, I was so sick that I couldn't even raise my head. And I said, oh my goodness, I know this is an infection process because the fever and what was happening. So luckily I keep a lot of these things at home, and I really tripled up on everything. And just by morning, I had no symptoms.
That's
Because I
right.
had no symptoms, I didn't stop everything, thinking, okay, I'm fine now. You continue on, because I needed to wipe all those bugs out.
Absolutely. But you knew what to do, Dr. Lee.
Yes.
And you know, your listeners really, at the first sign, they need to call you and come in or whatever, because you don't want to allow these superbugs to get out of hand like my accountant. And she died in the hospital, and she died quickly. So, and it could be very progressive.
Yes.
Our family friends up in the mountains that developed MRSA, I mean, it on the strongest oral antibiotic known to man, it jumped to under his arm, and it was all down there, and that was cultured, and of course it was the same MRSA as on his leg, and he had this open wound on his leg. So, and it was within 3 weeks, it was totally gone.
Amazing. I just
And,
want to share. Oh, no, go ahead.
and it was just an oral program. He really needed some IV work, but he just couldn't come down from the mountains to my clinic. So we had to treat it orally.
And that was during that time. So, you know, I had a young lady in her late 20s who I know quite well. And she came in one day, and I hadn't seen her for a long time. And she's nice size, not overweight, but she came in, she looked like she had been on chemotherapy. I mean, she was just wasting away. Her eyes were sunken in her head. She barely had enough energy to even come to the clinic. And I asked her what had happened. She said, I don't know. I've been to the ER 2 or 3 times. They can't find anything wrong with me. But I feel like, I actually feel like I'm dying. And she looked like it. At the time when she walked in the door, I'm like, oh my goodness. So I started asking her, getting your complete history, which is so important so you can find out what is going on with the person. And come to find out, she had gone to a dentist who had given her a very strong antibiotic when he did his dental work, which I don't think we need to have antibiotics with dental. You can do a proteolytic enzyme. But anyway, that's another story. And so I treated her in the clinic. She had an IV of vitamin C and treated her with the protocol. And before she walked out of my office, she was 80% better. 80% better that day. We have a caller. Caller, can you state your name and where you're calling from in advance? Thank you for calling.
Oh, it's my pleasure. My name is Kayla, and I'm calling from the Antelope Valley.
Thank you for calling, Kayla.
My pleasure. I heard you guys state about pathogens, and you had brought up a situation where you had some type of foodborne illness or some type of toxin from something that you ate. My question is, what, if any, are the future side effects of untreated foodborne pathogens, bacteria, parasites? Because I know a lot of people tend to gloss over that upset stomach after they've consumed bad food. I read in a research article that they had later discovered, it was a British article, I wish I had it to cite, that there could be future heart problems with untreated bacteria, pathogens, parasites. Do you guys have anything you could add to that?
Well,
go ahead, Dr. Lee.
Oh, well, that's one of the things I had brought up earlier because we don't know what organism it was that a person had been treated with Z-Pak, because now they're showing how that antibiotics can cause heart disease. But really, in essence, was it the antibiotic or was it the organism itself that caused the heart disease? We know that anything that is coming from the mouth has direct link to going to the heart in the first place. So if you have bad gums or, gum disease, your chances of having a heart problem is going to be very strong. I mean, we have that in medicine now too, as far as research. So a lot of things are basically overlooked. And if it's not treated well or aggressive enough, even in a natural form, if you don't continue, that's why I said you must continue this treatment. It has to be ongoing. I mean, it's a lifestyle change. And add these
Correct.
things to your diet, especially the non-corn vitamin C, which is a powdered form. You can do a little of that every day. I mean, to keep your resistance up, and immune modulators to modulate the body to keep the body a lot healthier too, and not so much taking things that are going to suppress the immune system. But I think a lot of times with foodborne illnesses, that's exactly what happens. And people are not taking the right proteolytic enzymes or enzymes to help with digestion in the first place. And with these foodborne illnesses, they're having problems. These things are laying dormant and mutating somewhere else in the body.
So
So
now my
especially,
next question, I'm sorry.
Well,
My next question
Dr.
would
Lee.
I'm sorry, Doctor.
You're,
I think he want to
you
add to it. Kayla.
Yeah, you're absolutely right. A real fast story. When my 3 children, we went with a lot of their friends down to Mexico, and we stayed and we got our water in the proper places, and we brought down our own food, and everyone was fine. We stopped at a restaurant out in the country on the way back, and everyone got Montezuma's revenge, big time. In fact, one of our son's friends missed over 2 weeks of school. He was so sick, totally bedridden. our kids got our, the flora and other stuff, and I really took it a lot, and I had queasy stomach and intestines, not like our friends, and that just goes to show you we got a foodborne, what they refer as Montezuma's revenge, usually from water, bad water. Even you got to watch ice cubes down there, and I had some discomfort, but our sons and daughters' friends were sick, totally bedridden. So go ahead.
So are these components that further break down the immune system? I know you said that they can be. So if they are, and say, hypothetically speaking, I was food poisoned or came across a foodborne illness a year ago, and I'm in your office, and now I want to know if you can locate the bacteria, the pathogens, the parasites, or anything that could have been associated with the foodborne illness. Is that possible?
I'm sure that Dr. Lee could, with time and a lot of expensive testing.
There's tests.
Yes, it might be better, Kayla, to just go ahead and treat it, assuming, it's a lot less expensive and a lot less time-consuming.
It certainly is.
Just to assume and presume, you can work with bacteria, with viruses, and with parasites all simultaneously.
And that's good. So you can take it in the midst of the illness as well as a follow-up product to maintain healthy gut?
Yes.
Yeah. Yes.
Mm-hmm.
Awesome. Can I order this from you, Dr. Lee, through your online store?
Well, we don't have an online store. We're working on that, but you can call the office. Let me just say this, too. There's a bacterium that I actually have labeled this bacterium as the kissing parasite. And that's H. pylori. Now,
Wow.
H. pylori it's an organism that cannot even be destroyed by hydrochloric acid because it's in the stomach. So we test that in the stool, but it gives you a different test. You have to do several stool cultures because you could miss it. You don't just do one. So if you went somewhere and did a stool culture, they said it's negative, but you have to do several. So H. pylori is tested in the stool, is tested in the blood. Now you can test it through a machine where you can breathe into the machine and it can pick it up. This is why it can be transmitted through kissing. And people are not aware.
How do you know if you have H. pylori?
There's subtle symptoms, and some of them are not so subtle. Burping is one. The belching is one. Some people have a little reflux. Any stomach problems, not so much gut problems so much, but stomach. If you have symptoms there, I tell everybody that comes in my door with any type of stomach problem, GI problems whatsoever, that's the test that I do. And that's just it's just simple.
Yeah, virtually all ulcers are H. pylori. An Australian doctor was ridiculed internationally for over 15 years, and when they discovered he was saying H. pylori is caused by a bacterium, stomach ulcers. He got ridiculed at international gastrointestinal symposiums. When they discovered he was right after 15 years, he got the Nobel Prize in Medicine. And also, it's also a very significant disease.
Yes.
An alarming heart condition called, you ready for this? Idiopathic cardiomyopathy. So it means idiopathic is a scientific word for basically dummy. I don't know. And cardio, heart, myopathy, wasting. So the heart muscle wastes away. And many times they don't test for H. pylori. And it could be the culprit.
Yeah.
So, this is a very important organism to address it causes all kinds of mysterious
Yes, it
symptoms.
does. In stomach, I have never seen a cancer patient, a person with stomach cancer. I've never seen one. Now, personally, I haven't. There might be people out there who have, who was not tested, who did not test positive for H. pylori. All the stomach cancer patient was positive for H. pylori too.
Yes, that's correct.
So these are little things that you can do, and just working on your body, keeping your body healthy. Things are transmitted, like you said, in water. We don't know what these particles are in our air. I mean, we've got a lot of stuff in the air. All you can do is take your finger and wipe across your car and look at all those particles that you're breathing in from outside. What is actually going into the lungs? We really don't know, but there are things that we can do. These are simple things. The non-corn vitamin C, especially the Enrich product. I mean, and it's such a great name, Enrich, because it really enriches your body. It enriches your cells, your DNA. It is such a wonderful product. Something simple, and it's safe for children
Absolutely.
because it
I'm a
actually
real
is a food. It's actually a
yeah,
food.
I'm a real proponent of vitamin C. It is amazing. If you follow, um, uh, especially Dr. Frederick Klenner's work, and he was reversing major viral disease that's life-threatening with simple high-dose vitamin C. And yet, to this day, if you get the same disease in the hospital, they don't use that.
Amazing.
And I know it's because it's not a pharmaceutical drug.
And they're not going
So
to make the money. I mean, it's a person right now um, that I can really help them. So, and actually it's so sad because it's a family member. And if they would just allow me to do this, get him on some vitamin C and some glutathione, um, things would turn around so much faster, but they're not going to allow me to do it right now. I'm kind of hoping and praying that I can work out something that they will eventually. But, we have to take better control ourselves too. And when it comes to our health, we really do. And like I said, these are certain things you keep at home. And not that I'm trying to push product, I'm trying to really let people know we want to have the best quality health as possible. I'm a grandmother of 9 and been in 2 comas years ago. So I do everything I can possibly to keep myself healthy and my children and my grandchildren.
absolutely. Kayla, are you still there?
No, she's actually gone. And I just
Okay.
didn't have a chance to
Okay.
thank her for calling. She kind of left us pretty quick. I think Kayla has children, so she might be dealing with her child there. But, this is very good, and I think more people need to go, especially these superbugs. This is one reason why, if you take people who still do a lot of fish, if you buy it fresh yourself, if you slice it thin and hold it up to a light, if it's worms and things in there, you can actually see them by holding them up to the light, the fish. So you have to be, we have to be very careful as to what we're eating. And this is why so many people are now becoming vegan and leaving the meat alone and things from animals because of the fact that what are they feeding the animals? I mean, the animals are not well themselves. Most of them are very sick. And they're resistant to antibiotics. We've taken so many antibiotics that it's probably in our drinking water. Who knows? Just we've been taking them for years.
Well, I know they've analyzed seawater near a major city. There's surprising amount of antibiotics, and it could be measured in the seawater. So
Isn't that
I'm sure
amazing?
it's getting into fish, but especially shellfish, which are caught in shallow waters. You can't help that. And this superbug situation is a lot more critical than people realize. And I don't think that it even troubles the doctors, the family doctors, and even some infectious disease docs. But what are you going to do? You have to do complementary integrative approaches. You can't just use the standard approaches anymore
They're
because
not
of these.
working.
That's why they call them superbugs. It's like Superman,
Yeah,
but they're
it's like
bugs.
you fed it a lunch, you fed it a dinner, and it's just not going anywhere. You might have wiped out a couple of them, but they're not going anywhere. It's just so sad that even just last night, someone called me and they were on their way to the hospital because their relative was taken in because of swelling in the arm, and then they said, "Oh, it's an infection," and there's an antibiotic going. So you're gonna do one course one night, and what happens? What's gonna happen to this elderly person in the next couple of weeks or so? Because you're not gonna wipe them all out; they're just gonna mutate.
Right, and the other problem, as you mentioned, the frequent use of antibiotics, the more resistant pathogens will proliferate because you don't have the good flora, the good bacteria. The antibiotics wipe that out. So there's always a double-edged sword with traditional approaches now.
And I think, and all they have so many new antibiotics now that it's just amazing.
Well, they have to, because of the acquired immunity of the superbugs. And they're very, what is called adaptogenic, and a new antibiotic may work for a year or so, and then it stops working. So these pharmaceutical companies are scrambling to try to find something against, a broad spectrum antibiotic against all these superbugs now. And it's just not MRSA. It's, C. diff, it could be necronizing fasciitis, E. coli, etc. The list goes on. So it's, and the actual testing you do may be effective, but the problem is when you do the blood testing or you do stool, etc., normal culture media, these superbugs may not grow in the test tube. And you don't really know that they're present. And that's what I found. I had a very dear friend who's one of the top immunologists in the world, and he told me that fact. He says a lot of these superbugs won't grow in a petri dish or the lab. They'll grow in your body, but not in the lab.
Now that's really frightening to know that you do a culture and you send it in and they come back. That's why so many of the tests that, they didn't find anything. They'll send the results back, and people have wasted so much money waiting to see what the organism was that was in their body from the lab, and now you're saying it doesn't even grow. It'll grow in your body, but not in the dish, and that's where it's supposed to grow so they can find out what it is. That's really frightening.
Well, it's very true. And I've had quite a few dear friends with this exact problem. So, you have to work an integrative approach. It's not just what traditional approaches will do. Integrative means it's both traditional and ancillary other approaches to help with the problem. And when it comes to infections, this is critical.
Yes, it is.
I can't stress enough how critical this is.
And the thing is, when a mother is when she's pregnant, and come down with a cold or end up with maybe bronchitis, the first thing they're going to do is put her on an antibiotic. Look what's happening to the fetus. But this is all food source. This is why I have this show. This is why I take the time to do this, because this is natural. I want to quickly say something in regards to the gums. It's something that I use. There's one dentist that I know that I know of. I never went to him. I deal with 4 different biological dentists personally. And some friends of ours had gone to a dentist in San Diego who would not touch your teeth until he swabs it and look to see how many bugs are going on under the microscope, and he shows you. Now, some friends of mine said, well, let's just see. We know that orange oil, the company is TKO. Actually, it was designed for house cleaning. We also know they get rid of termites with orange oil. But a couple of drops in some water is natural, is safe. So they gargle with this, put their toothbrush into this water, brush their teeth with the orange oil, went back and let the dentist swab their mouth, and there was absolutely no bugs. No bugs in their mouth.
That's correct, yeah.
Yeah.
And some of the other citrus and citrus seed oils, it is amazing what they will do. And it's not per se toxic to you.
Right.
Some simple approach.
Because we have someone who asked a question and said that they had swelling, Linda, and I can't make all this out. I really should have my glasses on. But had used lemon water for swelling of her gums. And thank you so much, Linda. And what happened was the swelling went away in 2 days. So thank you for sharing that with us too. Because I know I like things that I see scientifically is taken care of, and I know with the orange oil, you actually, I had my little grandson. Well, he's not little. He was 10 at the time, and he had a sore throat, and I said, okay, I'm going to culture it because I want to make sure it's not strep. Because strep, we're going to be a little bit more aggressive in our integrative approach, not antibiotics, but integrative approach. But we have to make sure we get rid of the strep organism because we know it leads to heart disease and kidney disease. So anyway, he didn't have strep, which was great, but he did have an infection going on in his throat. But I had him to gargle before the test and after the test. So I sent 2 cultures in that day. One came back and showed an overgrowth of what he had, and the next test showed negative. So I was curious, so I did the test myself on my own grandson. And not only that, nothing grew out from the culture. The one good thing is that his sore throat was gone within 5 minutes.
Yes, absolutely.
So do people want you to put this on the market? No. You know why? Because, that's really, really inexpensive.
That's correct.
So it isn't any type of orange oil. I know the company is called TKO, and it's just a drop, like 1 or 2 drops in 4 ounces of water. That's all you need. 1 bottle will probably last you and your family a lifetime because you need very, very, very little. But it's so good to put it in one of the little mist bottles to spray your house with and clean your countertops with it because we know that it definitely kills bugs. And it makes your house smell good too. It's just a nice smell, a nice clean orange smell. So I really advise people to have this in your home. Actually, it unstopped the toilet. I mean, pretty powerful. Pretty powerful, to cut through all that and unstop a toilet by itself. And safer than pouring chemicals somewhere. The chemicals are not great because you're going to inhale some of those fumes from the chemicals. So I tell people with household, and this is basically almost one household item you would need to clean the house and keep at least keep your mouth healthy. I think they have shown that there's more bugs in your mouth than there are in your colon. People always talk about detoxing, and I always ask them, what are you detoxing and where you're starting? Because it's so important when you talk about I want to go through a detox program. You got to detox the whole body. And first, with me, I start with detoxing the body from negative thought patterns. We have to start there, then we go to more of what's going on with the body itself.
Yes. This is I. While you were talking, I went on the website for this, and this is amazing. This TKO.
Oh no, TKO is amazing. Yes, I really I keep it at home. I keep it in the clinic. Um, and sometimes people come into the office don't with a scratchy throat, cold. I just say here, just it's a couple of drops, go and gargle, and we do everything else. And I like people to leave me, leave the clinic feeling better than they did when they walked in the door. I have devices if you have pain, whatever's going on. Because number one, we put God first. We pray and put God first. And we have wonderful results because of that reason.
Yes. There's so many things you can use, and it's not like some of these really strong commercial things. You could use for cleaning grease and oil, etc. is what it's saying.
Oh, yes, it's
So,
wonderful. It is a wonderful product. And, I see them once a year at a convention, and I usually get my gallon, which, I don't even know why I get a gallon because I go share it with everybody. That's why, because it lasts me forever. I make sure all my family have it and everyone else, but it's a wonderful product. Especially, like I said, not a dropper, but just drop, like one little drop in 8 ounces of water. Use about 3 of those, gargle, put your toothbrush in that water, brush your teeth with it, and it's amazing what it does for the body.
yes.
It is
Well, there's a lot
amazing.
of things that are natural that could be used like this, and
Oh, yes, and inexpensive. Very inexpensive. No,
yes,
very inexpensive. But back to resistance, and I'm so glad you just to recap on a couple of things. I'm glad that you, Dr. Takemoto, was able to share with our listening audience about because so many times people will do cultures, but a lot of clinics I'm noticing don't do as many cultures. I used to see that done a lot. I don't see as many. They just said we're going to give you a broad spectrum antibiotic, and here you're out the door, instead of maybe trying to find out what it is. But if it's not going to grow in a petri dish, then it is growing in your body. You won't know what it is anyway. So basically, they just kind of treat the symptom of the symptom you came in with, and that's it. But when it's the symptom of a superbug, they're going to hit you with everything. And this antibiotic with the young lady who I told you looked like she had been on chemotherapy was from her dentist who gave her the antibiotic. And the antibiotics actually destroyed the lining of her colon. That's why she was so sick. That's why she had constant about a diarrhea. And who would have thought? She didn't think that's what it was. And as soon as we went through this treatment and got her, set her up on the product, she took some here in the office and had an IV. I'm telling you, like 80% better the next day. And actually her white count, when you're looking at infection and some other components of lab work, because I believe in looking at the blood work too, we saw a major difference in just 4 days. Actually, her white count had gone to normal. It was double the amount the first day and it had gone to normal in 5 days.
well, of course, that's great news from traditional monitoring of the white count. So, I can't say enough about that.
Yeah, so the lymphocytes and looking at all the components, the differential components. And I tell people be very proactive if you go somewhere and have lab work done, because so many people have insurance and they want to maybe utilize the insurance because we can't convince maybe all of our family members and friends to do things on a natural level. So I tell people make sure that you um, ask for copies of your lab work. I know some hospitals now will give you a password and you can see your lab results on the internet. But be very proactive and know what these components mean. Because some people have been like borderline, we're talking about superbugs, but even with the kidney lab tests, they were like borderline normal, but it was on the borderline to be elevated. And, so they go in annually. So the next year they go in, they'll say, oh, it's somewhat elevated. Oh, we're just going to watch it. So if you're going in annually to have this checked, the next time you go in it's high. And I had a couple of patients tell me from their primary care, well, we'll just wait to see what's going to happen here. Um, we'll wait and see, then we will start you on dialysis. So it's not, let's just see what we can do to help you to heal. Let's just see what we could do to find out why this is happening. We'll just wait and see till it gets to the point, number wise, so that we can get you on dialysis.
That is not a very pleasant
that really
procedure.
amazes me. That really amazes me. I'm in a medical building where there's a dialysis company. I'm on the fourth floor, downstairs in my building, and next door there's another dialysis, and they are busy 7 days a week.
Oh, yeah.
It's just so sad. It's just so sad to see so many people from every age, in there going for that type of treatment 3 times a week.
Yes.
But nobody says
yeah,
anything.
you want to avoid dialysis because it shortens your lifespan. So just the procedure alone, of course, you have to have it if you're in kidney failure. You have to.
Yes.
But, why don't people have to avoid that, and they need to see someone like you that if their kidney numbers in their blood test is a little elevated, that they need to take care of this instead of waiting till it gets worse and worse, and then their family doctor may or specialist may say, oh, well, we always have dialysis. So you want to avoid that point. That's all I can say.
One lady, some years ago, she called me and she wanted to make an appointment and come in, and she was in tears. She said, I feel that I'm going to die. And when a person tell me this, you have to really take note of that. You know your body better than anyone else. And she said that her doctor, who told her kidneys were getting worse and worse, like we just discussed, put a shunt in her arm. So he said, well, I'm going to put this in your arm and we'll start you on dialysis in about a year. And in the interim, sadly enough, the doctor passed. And then no one wanted to remove the shunt that was actually inflamed. I couldn't believe it. I said, no, go back to she was part of HMO. I said, go back and tell them, if it's inflamed, they have to do something instead of you coming to me, because I don't remove things like that. I don't do that. But they must take care of that. So I called her, and I wanted to send her to someone else who was a kidney specialist who was going to take care of her at a much better level, who also believes in integrative medicine, since she had a shunt. So when I called the agency who she was working with, I said, I need you to disenroll her today so I can get her to another doctor because this lady is not well. They said, oh, no, we can't do it today. It takes paperwork. It takes this. It takes that. I said, you don't understand. She needs to be disenrolled today. So I had to finally take it to another level with this person on the phone. And I said, well, how much paperwork would you have to do if she passes?
Jeez.
And you know what he said? I'll take care of this right now. And you know what? He called me. He called me after we got off the phone when I was finished, speaking on the behalf of the lady. He actually called me. He said, I must come and see you. I don't know anybody who would had taken this much time with a person to help them. He said, I want to meet you and come see you for myself.
Yes.
But I care about people. Yes. My own health history and journey is one doctor when I was 7 who cared enough for me that he stayed there and helped me so I didn't have to have my legs amputated. So those things stayed with me, and they're still with me. And I have this passion to want to do for other people.
Oh, I agree. I wish there was more doctors like you. You know, as you go further east, because I work with doctors all over the world, they get more and more conservative and dyed in the wool, pardon the expression, pardon the word dyed in the wool approaches, and they're not as willing to be more open. And it's a great state, California, compared to the rest of the states, that, you know, there's far more flexibility here and more openness with some doctors and people's thinking. So, and it's people like you that have really helped people. I'm sure you've helped a lot of people with their health and prevented them from dying and suffering. So I have to commend you.
Well, putting God first is my key. And that's what I do, is put God first. And
Absolutely.
that's why we have the results that we do. Because to me, for me, the number one healer is someone much larger than I am, and a higher being. So that's important for me as far as working with people.
Yes. No.
Is to meditate and get them to go and to know. You can turn a lot of things around just through meditation. There's a lot of research on meditation and prayer for
Yes.
healing. So we must
Absolutely.
relax and get the body relaxed so you're not in this stress mode where it's just draining those adrenal glands and the cortisol level is going up. We have to get into a more relaxed mode so the body can heal.
I agree wholeheartedly. Um, there is a lot of these skin eruptions I've seen also are due to some of these pathogens that are resistant to traditional approaches. And you wouldn't, and their doctors, even specialists, aren't equating it to potentially toxins in their body or mouth, especially in the gums or jawbone, that are causing a skin eruption. So they suppress the skin eruption with the use of corticosteroid creams, and they're not addressing the cause of what's actually causing the problem.
And when you say skin eruptions, that's like a person have a rash on their arm or lesions on their arm, but basically a lot of lay people would kind of see it as a rash on their arms, legs, face, neck. It could be across your stomach, your back. People have had it, the yeast kind of break out underneath their breasts, the women. It gets very raw. And nobody, like you're saying, they don't address the whole picture.
Absolutely. And just yeast alone, there's at least 72 known documented toxins, of which 2 can cause cancer. So it's the byproduct of simple Candida albicans or yeast infections that we get, particularly women. So it's very important to address these kinds of problems. I can't stress it enough, and especially in today's world where we have GMO foods, we have pollution, we have stress, economic stress, and all this takes your toll on your body.
Yes, it does. Yes, it does. And I just want to say, let me just give up some information. If you have any questions or you had a question that you didn't have a chance to email us or call in, you can always call me at the office at NutriMed Integrated Healthcare at 310-419-4300. If you have a question, you can definitely email us today at innerlightradio@yahoo.com. So we are here for you. And again, if you have any questions, And we have archived our show. So if you're listening to the show today and you want to share it with a family member or a friend, it will be on our archive list by Friday. So you can go to the Cherilyn Lee, which is my name, Cherilyn Lee Health Show .fm, and go to the YouTube channel there, and everything is saved there. So we have a lot of shows that are there, from dental problems to you name it. Please listen to the shows and share them with family and friends and your loved ones, because it's so important that each one teach one. And that's how we're going to get ahead, because there's just so much happening in the world today, especially within the media. People are watching the media that is really taking its toll on your immune system. Just to listen to what's happening in the world today will take its toll on your immune system. I can guarantee you, if you sat there and watched the news for an hour, I could take a pH paper and test you, and you will show that your body is very acid, because it's so devastating, all the things that are happening. I think we need to be informed and be aware of what's going on around us, but please don't just sit and watch the news, hour after hour after hour, because it is doing something to your internal immune system. Be very careful with that.
Well, you're so right, Dr. Lee. Just remember, just reiterating that phrase, the first and last defense against a foreign intruder is still your immune system. And
Yes.
it's not colds and flus. As you mentioned, the H. pylori. There's other pathogens called chlamydia and pneumoniae. There is the cell wall deficient forms that are proliferating now called mycoplasmas. And, of course, we have the epitome of a life-threatening disease, and that's a big C, or cancer.
Yeah.
So, your immune system affects heart disease. It affects gastrointestinal problems, skin eruptions, cancer, your longevity, the way you feel. And there's links to numerous diseases that are linked to bacteria. A close friend of mine, son, developed a very virulent, I like to use the word virulent, he developed Epstein-Barr, very significant infection, and he was in a college town, did not want to come down to Phoenix area to get treated for his Epstein-Barr, and didn't want to take anything that the mother wanted to send up there. Well, down the road, he developed life-threatening disease. He developed acute lymphocytic leukemia, immediately was hospitalized, very, very bad shape. Platelets were, 18,000 or 14,000 from the destruction of these immature white blood cells in his bone marrow.
Right. Can I get you to hold that thought just for a minute?
Sure.
I hate to cut you off, but we do have a caller. Caller, state your name and where you're calling from. I think this is Miss Williams.
Hi, this is Devanay Unleashed, and I'm listening to the show. Hello, everyone.
Hello.
I was very interested in your comment that you made, Dr. Lee, about the immune system and the effects of society and what's going on in the world. It's unbelievable that it causes so much damage to our thoughts and our mind and our body when we do listen and watch different programs and listen to different radio stations. What do you feel would be the best thing for all of us to do?
Well, you want to be informed, because we're in this world. We do want to be informed as to what's going on. But then do something, go for a walk, go do something fun. Get on, call a good friend where you can have a good laugh. You have to do something to turn that around so the body can release healing endorphins in the body. which I find to be very important. So as soon as you can do that and start turning some things around, you will start. It won't just damage your DNA so much. You know what I'm saying?
Yes.
Um, go for a bike ride, go for a walk, but do something that's fun for you.
But can I also suggest something, Dr. Lee, that in this day and time, we have so many objects, and I didn't mean objects, so many different things to turn on and turn off, the tweet and the messaging and all this. If we could just eliminate some of that every day, it might help a little bit.
It'll help a lot. Spend some time with yourself. Find what it is you like to do. If you like to paint, if you like to draw, if you like to write, use some of that time for you instead of all this other stuff because you started reading all these tweets. I mean, you could do that for 24 hours and never go to bed because there's so much stuff out there on the internet now. So, but pull away from it and say, I'm going to spend this I might listen to something maybe for 10 minutes and then I'm going to take the next hour to do something for me or to just sit and meditate and pray. But do something positive for yourself. Love yourself and take time to do some things for yourself.
Well, thank you so much, Dr. Lee. That was awesome. I really needed to hear that.
Oh, you're more. And you sound absolutely wonderful. Thank you so
Thank
much,
you.
Devaney Unleashed, that will be on in about another hour or so. Thank you so much.
Thank you.
Thank
Have a
you.
blessed day.
You have a wonderful, blessed day also. We have another caller calling from area code 213. Can you state your name and where you're calling from, please?
Dr. Lee,
Yes.
this is Richard Hanner calling you.
Hi, how are you doing?
Yes, I'm your patient. I'm
I
your PA.
know. How
How are
are
you,
you?
sweetheart?
I'm
I'm
blessed,
well.
thank you.
Yes, I thank you so much. I thank God for you. Dr. Lee, I just wanted to make sure that I got that the address for the archive so I could go in and take a look and look up some
It's
things.
the Cherilyn Lee Health
Okay.
Show .fm.
Okay. Okay,
And then
great.
the clinic number is 310-419-4300. Call me after the show.
Gotcha. Okay.
Okay.
Have a blessed day. Love
It's
you.
good to
Bye-bye.
hear your voice. Thank you so much. God bless
All
you.
right. Bye-bye. Bye-bye.
Bye-bye. Okay, I'm so sorry to have cut you off, um,
No, well,
Dr. Tucker.
briefly, the friend of mine, close friend of mine, of course, her son's in the hospital. Been in the hospital for now about 35 days, and the oncologist involved. She says, "Well, maybe it's." She asked me, and I said, "The Epstein-Barr, which is very, very common virus, is one of the chronic fatigue viruses, and a mutant can cause mono, and another mutant can cause Burkitt's lymphoma cancer. This is well established clinically." And the oncologist said there's no link, absolutely no link, with your son's acute ALL leukemia. So she gets on the internet, and even in the American Cancer Society website, there is evidence to support that Epstein-Barr virus can cause ALL leukemia. So not even a top-notch specialist, oncologist, hematologist is aware of it because he wasn't taught that in medical school. And do you think the pharmaceutical reps that call on him even mention this fact? Of course not.
In my CRT, that I do early screening for breast cancer, is FDA approved, but it has 119 acupuncture points, so I go through the whole body. And things that come up in the sinus cavity, it always mentions to do Epstein-Barr virus blood tests, CMV, and plasmatoximosis testing.
Yes.
Yeah,
I would also add HHV6, which is getting more and more prevalent now. Human herpes type 6.
even without lesions.
That is correct. And I'm finding that in testing. I have my doctors test for it, and they said, why should we test for that? And they get rather surprised. If it's a virulent virus, and also if people have animals or they've been exposed to different animals, they may want to test for parvo, because parvo can breach the dog, cat, horse, etc. barrier to humans. So it's and the testing is surprising. The doctors that I train that test for these different viruses are extremely surprised at the outcome, and there's really nothing they can do with traditional approaches. They have to use some of the modalities that I described earlier, and they get great results before and after testing. And of course, the patient, their symptoms just plummet and go away. So, and it's not commonly done. It's even rarely done by specialists in infectious disease.
Exactly. You know, we have
What are they going to do?
Yeah, and we have a question. I'm not big on any type of sugars, because the breakdown of the body when you look for yeast. But we have someone from Facebook. Um, their question is: you mentioned that sugar is a haven for disease. I found a product called maple sugar, which is a non-GMO, gluten-free, dry crystallized maple sugar. What is your opinion about this product? Personally, I
Should
don't.
I answer?
You can
Should I
answer that.
answer? Or you?
You can answer it.
Sugar is sugar unless it's a special form, like xylitol or some of these other sugars. In fact, xylitol, they put in toothpaste to make it taste good, but the mouth bacteria can't even utilize it to grow and proliferate. But frankly, is this raw maple sugar crystals better than table sugar? Yes. But it still contains appreciable amounts of fairly simple sugars that can easily break down into glucose and proliferate diseases. So try to minimize sugar. And if you do eat sugar, don't do it before you go to bed, because it can raise blood sugar levels. You're not exercising, your mind is more stagnant and resting, and you're not utilizing the sugar, and so it can maintain higher levels of sugar in your bloodstream and cause immunosuppression and grow these pathogens. Because that's how you grow pathogens in the lab. You actually have to put some simple sugars in there so these bacteria or cell wall deficient forms can utilize it.
Yes.
Yeah.
And you know, this has been such a great show. I want to thank everyone. We're really running out of time now. I want to thank everyone for tuning in to the Cherilyn Lee Health Show .fm. Thank you. We're here every Wednesday from 11 to 12:30 Pacific Standard Time. Our phone number to the clinic is 310-419-4300. And please visit our website also, the Cherilyn Lee Health Show .fm. Thank you so much for tuning in today. Thank you so much, Dr. Takemoto, for being here. You are no stranger to us. You will be back again. I pray that we were able to help save some lives today and get some light on other things going on with people. I just thank you so much. Thank you, Jamal at Inner Light Radio, the healing frequency. Have a wonderful and blessed day. Bye-bye.